Hey there! In this video, we're going to talk about two clinical indicators that could help us to predict the development of diabetes type 2. In our earlier videos, we have spoken about insulin resistance, and insulin resistance, of course, is a clear-cut indicator that a person is at risk of developing diabetes type 2. Now, what are the other two indicators? But before we get into that, welcome to the Wellberry. I'm Dr. Nirmala. The purpose of these videos is to throw light upon metabolic disorders and to also show you that by correcting our lifestyle and nutrition, many of these metabolic issues can be corrected. But before we go any further, here's the disclaimer. This video is not a medical consultation. If you have any medical issues, then please do consult with a professional for guidance. Now back to the topic for today. What are the two indicators, apart from insulin resistance, that could give you insight into the fact that you could be at risk of developing type 2 diabetes? The first one is a high level of triglycerides, which is commonly known as bad cholesterol. Why is it called bad cholesterol? Because a high level of triglycerides indicates that there is a higher risk of cardiac or heart-related problems. So the easiest way to know whether you have high triglycerides is by doing a lipid profile. This is a blood test. And usually what we look at is fasting lipids, where the person has not eaten or had anything to drink for at least about 10 to 12 hours. When we look at the lipid profile, we have to look at the triglyceride value. Is it above the normal range? And if it is, then we also have to look at certain other indicators like the ratio of the triglyceride to the HDL cholesterol. Now, the HDL cholesterol is considered the good cholesterol because it has a protective impact on the heart. So how do we get an abnormally high triglyceride level? Triglycerides are the fats that are stored in the body. When we eat in excess of the amount of calories that we actually need, then the body has to store this calorie somewhere. Now, this way of storing triglycerides is actually a protective mechanism for the body. Thousands of years ago, when our ancestors were hunters and gatherers, there would be long periods of time where they would not have food. Now, during these times, the body would then tap into the stored triglycerides in order to get energy. However, with today's urban lifestyle, where most of us have sedentary jobs, then there is no chance for the body to tap into these triglyceride reserves. So the triglycerides keep getting stored into the fat cells, and then the body becomes obese or else goes in for having metabolic disorders. So even if your sugar levels are normal and your 3-month average sugar, that is the HbA1c, if that's normal, but your triglyceride levels are on the higher side, then you need to be watchful and see whether you are at risk of developing diabetes. The second clinical parameter which would indicate the risk of developing diabetes in the future is a high diastolic blood pressure. The diastolic blood pressure is the reading that's given at the bottom. A normal blood pressure reading would be 120 by 80 mmHg. mmHg is the unit used to measure blood pressure. Now, each person's body is different. So, for some people, the normal BP may be 110 by 70. For others, it may be around 125 by 85. So, 135 by 85 would indicate borderline high BP, and anything which is above 140 by 90 is clearly high blood pressure. So if a person consistently shows borderline high blood pressure, the doctor is going to start cautioning him or her that their BP is high and that they need to make changes. Now this again, like I said, is an indicator that in later years the person may develop diabetes as well. So if you have high blood pressure, especially the diastolic blood pressure being on the higher side, or if you have high triglycerides, or maybe you have both high BP and high triglycerides, in that case, you need to be watchful. You need to start taking note of certain things. Are you obese? Do you have fat collection around the abdomen? Do you have a strong family history of diabetes? For example, are your grandparents or parents diabetic? Or maybe your uncle or aunt is diabetic. And of course, this would then also be an indicator for you to get tested for insulin resistance. What you also need to know is that high blood pressure, high triglycerides, obesity, especially obesity around the abdomen, and diabetes. These are the four cornerstones of what is known as metabolic syndrome. The good news is that metabolic syndrome can be reversed if we have the right kind of nutrition. In some cases, there may be a need for medication, but to a great extent, metabolic syndrome can be reversed with the right kind of nutrition. Now, let's just summarize what we've talked about so far. If you have high blood pressure or high triglyceride levels, it could indicate that you are also at risk of developing diabetes. High blood pressure, high triglycerides, obesity, and diabetes. These are the cornerstones of what is known as metabolic syndrome. And the third point is that if we correct our nutrition to a very great extent, we can reverse or at least minimize the damage that is caused by metabolic syndrome. I hope you found this video to be helpful and do share it with others. You never know who you may be helping out. And until next time, this is Dr. Nirmala signing out, and remember that wellness begins with your plate.